Malaria. It's a name we've all heard, right? But the reality of this parasitic disease is way more complex and frankly more deadly than most of us realize. In this explainer, we're going to break down the science of how it literally hijacks the human body, and then explore the incredible fight to finally, hopefully, eliminate it.
We have to start with this number because it's just staggering. Over 600,000. That is how many people die from malaria every single year. This isn't just some distant tropical illness. It's a full-blown global health crisis, and understanding it is the absolute first step in fighting it.
So, to really get a handle on this story, we're going to follow it in 5 parts. First, we'll cover the setup, meeting the key players. Then, we'll witness the invasion as the parasite takes over. After that, we'll look at the fallout it leaves behind. Then we get to the good stuff, the counterattack from science. And finally, we'll look ahead to the endgame, the path to wiping out malaria for good.
All right, let's kick things off with part 1, the setup. The story of malaria really boils down to 2 main characters, a very specific type of mosquito and the microscopic parasite it carries. You know, it all starts with a single bite. But here's the thing, it's not just any mosquito. It has to be a female from the Anopheles genus. Think of her as the delivery system, the vector, because the real culprit is the parasite she's carrying, a nasty little thing called Plasmodium. And this is super important. Malaria isn't just one thing. It's caused by 5 different species of this Plasmodium parasite. The one you really need to know is Plasmodium falciparum. I mean, that's the big one, the deadliest by a long shot. But others, like Vivax and Ovale, they have this really sneaky trick up their sleeve. They can go dormant, just hiding out in your liver for months or even years, and then bam, cause a surprise relapse long after you thought you were in the clear.
So how does this tiny parasite actually take over? Well, that brings us to the invasion. Once it gets inside your body, it launches this incredibly complex, multi-stage mission to basically hijack you from the inside out. The whole process is just deviously clever. First, these little parasite forms called sporozoites literally race from the mosquito bite straight to your liver. And there, they multiply in secret. At this stage, you don't feel a thing. But then, thousands of new parasites, now called merozoites, burst out and launch the main assault on your red blood cells. They invade, multiply like crazy, and then rupture the cells in these big synchronized waves, just unleashing a whole new army to do it all over again.
And that right there is the key to malaria's most famous symptoms. Those awful, intense, repeating waves of fever and chills. That is literally the feeling of millions of your red blood cells bursting open all at once, over and over and over again. So this relentless cycle, as you can imagine, leads to what we're calling the fallout. What does this siege actually do to the human body?
You know, malaria really has 2 faces. On one hand, you've got uncomplicated malaria, which feels like the worst, most brutal flu of your life, coming in those cycles. But here's the scary part, it can escalate and fast into severe malaria, and that is a whole different ballgame. We're talking a true medical emergency. Coma, seizures, your organs just shutting down.
So how does it get that bad? Well, that deadliest parasite, P. falciparum, has this unique and incredibly dangerous mechanism called sequestration. It basically makes the red blood cells it infects sticky, super sticky. These sticky cells then start clinging to the inside of your tiny blood vessels, creating these little blockages. Think of them like microscopic traffic jams. And when those jams happen in your brain, they cut off the oxygen supply, and that's what leads to the dreaded cerebral malaria.
And the list of potential complications is just devastating. Cerebral malaria is obviously the most feared, but those blockages can also cause your kidneys to fail, fluid to fill up your lungs, and of course, profound anemia from all those destroyed red blood cells. And for pregnant women, the risks are just terrifyingly high for both the mother and the baby.
But here's the good news. Humanity is not defenseless. So now, let's turn to the counterattack and the incredible scientific tools we've developed to fight back against this parasite.
The first punch in that counterattack is a solid diagnosis. Now, while there are rapid field tests, the real gold standard is a blood smear, where a trained technician actually looks under a microscope to physically see the parasites inside the red blood cells. Pretty amazing, right?
When it comes to treatment, the absolute cornerstone is something called ACT, artemisinin-based combination therapy. This isn't just one drug. It's a super strategic, 2-pronged attack.
A fast-acting drug wipes out most of the infection really quickly, while a longer-lasting partner drug sticks around to mop up any survivors. This combination is absolutely crucial for preventing the parasite from developing drug resistance.
And the treatment really has to be tailored to the specific parasite. For the deadly P. falciparum, ACT is the way to go. For those sneaky relapsing types, you need an extra drug, primaquine, to hunt down those dormant parasites in the liver. And in a life-or-death situation with severe malaria, the absolute game-changer is intravenous artesunate, which launches a rapid, overwhelming assault that saves lives.
Treating the sick is vital, of course, but the ultimate goal is to stop people from getting sick in the first place. And that brings us to our final section, the endgame and the global strategy to finally wipe out malaria.
You might be surprised that the foundation of malaria control is actually pretty low-tech, but it is incredibly effective. Simple tools like insecticide-treated bed nets and indoor spraying form a powerful shield. I mean, they are the absolute front line of defense, preventing the mosquito bites that start the whole process. These simple tools have already saved millions upon millions of lives.
But now, we have a powerful new tool in the toolbox: vaccines. For decades, a malaria vaccine was the holy grail of public health. The first one, RTSS, showed about 40% efficacy, a solid start. But just look at this leap forward. The second-generation vaccine, R21/Matrix-M, is showing around 75% efficacy. This is a monumental, game-changing step forward.
So here's how the strategy is evolving. Today, we fight with nets, sprays, and effective treatments. In the very near future, we add powerful, high-efficacy vaccines to that arsenal. It's this combination of tools that finally makes the World Health Organization's ambitious goal of malaria elimination by 2030 feel like a real possibility.
Okay, let's just quickly recap the absolute must-knows. P. falciparum is the deadliest strain, ACTs are the standard treatment, IV artesunate is the lifeline for severe cases, and the new vaccines are completely changing the game for prevention. But the most important takeaway is this: no single tool is a magic bullet. Only an integrated strategy gives us a real shot at elimination.
And this leaves us with a final thought. For millennia, malaria has been an unbeatable foe. But for the first time in history, with powerful new tools like the R21 vaccine added to our arsenal, the question is no longer if we can win, but when. The science is there, the tools are there. The question now is, will we be the generation to finally see the end of malaria?